Okay, and I hope, copies of this report have been made available to people for the session here this afternoon. Great. Okay, we said we'd hold back because we were afraid that people would be leafing through them and reading it during the morning session. So now is your time to peruse it. So this afternoon's session is somewhat ironically looking out at the grey clouds over Dublin. It's a blue sky thinking session. So it's about the sort of big, bold, ambitious edge of what we might think possible ideas around tobacco control. And I think in terms of the discussion that we're having this morning, we heard a huge mandate from our Taoiseach this morning. He's encouraging us to be ambitious. He's certainly with us in terms of our goal around a tobacco-free Ireland. So as we explained, we did some work in the Tobacco-Free Ireland programme to involve the public. We wanted to understand what their views were on tobacco endgame. So this afternoon, I'm going to start off by introducing Dr. Ellen Cosgrave, who is a specialist registrar in public health medicine, and she was the lead researcher on our endgame survey. So I'll bring Ellen to the stage in a moment. And when Ellen has presented her report, we're then going to hear from the RCPI policy group, from their chair, Dr. Des Cox. And finally then, we're also going to hear from Norma Cronin, who is the chair of ASH, and from Mark Murphy as well, with ASH Irish Heart Foundation. So, Ellen, I think you're opening the session. Is that right? Yeah, okay, great.
So thanks very much for that, Paul, and I'm delighted to be here today to present to you our work entitled Is the Public Ready for a Tobacco-Free Ireland? A National Survey of Knowledge and Attitudes Towards Tobacco Endgame in Ireland. First off, I'd just like to acknowledge the work of the Tobacco-Free Ireland team, Paul, Ed, Martina, Aisling, and also Dr. Frank Doyle, who all contributed to this work. And I'll first take you through some background context to tobacco endgame and then present our findings of the survey for your consideration. So tobacco-related harm is the leading cause of preventable death worldwide, contributing to 7 million deaths annually, 600,000 of which are due to secondhand smoking. In Ireland, tobacco-related harm causes over 4,500 deaths and leads to 44,000 hospital admissions annually. 1 in 2 people will die of smoking-related harm. 1 in 2 people who smoke will die of smoking-related harm, and smoking reduces life expectancy by 10 years on average. Meanwhile, as Dr. Kavanagh outlined earlier this morning, although Irish smoking prevalence had been steadily declining in recent years, it has actually risen 1% between 2019 and 2021 to 18%, raising the question as to whether this progress is now beginning to stagnate. So efforts to tackle the harm caused by smoking have been traditionally framed as tobacco control, with the aim of reducing the impact on health. Ireland has made good progress with tobacco control, showing strong leadership with bold measures like the workplace smoking ban in the early part of this century. These efforts have translated into reduced smoking prevalence, and Ireland is now entering the late phases of the tobacco epidemic. However, approximately 1 in 5 Irish adults still smoke, and tobacco is still widely sold despite its lethality when used as intended. It is clear that there is a need to challenge social norms which continue to accept tobacco as a normal consumer product and instead reframe tobacco as a harmful product which, if used as intended, leads to death for more than 1 in 2 users. In effect, there's a need to reframe goals from controlling the harm caused by smoking to eliminating it completely. In other words, we need to now shift from tobacco control policy to tobacco endgame. But what is tobacco endgame? Tobacco endgame is an ambitious concept which envisages a tobacco-free future, involving policies, plans, and interventions aimed at ending the tobacco epidemic. Crucially, we must be clear on what we mean by tobacco endgame and distinguish how endgame is not just an extension of current business-as-usual tobacco control measures, but involves the introduction of new, bolder measures designed to bring the tobacco epidemic, one of the biggest public health challenges of the last century, to an end. Drawing on what Dr. Newman was speaking about this morning, we need to look at this infinite mindset instead of pre-existent finite mindset, maybe that was more associated with tobacco control. So the endgame approach involves establishing a clear endpoint by a defined time and then planning backwards to ensure that this is achieved. And the goal of endgame is distinct from tobacco control in that it seeks to change permanently the structural, political and social dynamics that sustain the tobacco epidemic in order to end it by a specific time. What's more, tobacco endgame is not designed to divert resources from existing tobacco control measures. Rather, it seeks to build on implementation of the WHO Framework Convention on Tobacco Control, while simultaneously introducing new, bolder measures to accelerate reduction of smoking prevalence to very low levels by a defined time. The Irish government committed to tobacco endgame through the current goal, Tobacco Free Ireland, which aims to reduce smoking prevalence to less than 5% by 2025. However, as of 2022, this target is increasingly unlikely, indicating the need for new, more bold and ambitious tobacco endgame strategies to build on established business-as-usual tobacco control measures. So as discussed, in 2013, Ireland became one of a small number of countries adopting official endgame targets. So where does Ireland's target stand in relation to international counterparts? Well, as you can see here, similar to Sweden and New Zealand, we have a goal to reduce smoking prevalence to less than 5% by 2025. Other countries then have identified longer timeframes within which to achieve endgame. For example, Australia, Finland and the USA aim to reduce smoking prevalence by 2030, and Canada aims to achieve endgame by 2035. So tobacco endgame seems to target the upstream supply of a harmful consumer product which profits the tobacco industry at the expense of population health. Tobacco endgame tactics can be classified into 4 themes: product-focused, which target tobacco product appeal and addictiveness; institutional structure-focused, which directly target tobacco industry production; user-focused, which target tobacco affordability and access; and supply-focused, which target product availability and retailers. Table 2 presents examples of proposed endgame tactics within each theme. Product-focused tactics include, for example, the proposal to reduce the nicotine content in tobacco products to very low levels, while institutional structure-focused tactics include increasing tobacco industry accountability for tobacco-related harm. Then looking to user-focused tactics, these include increasing the minimum legal age for tobacco sales, while supply-focused tactics then include the proposal to phase out tobacco sales completely. Different tactics might be more appropriate depending on the different unique national context or the different needs of different populations. No one measure is going to achieve endgame in isolation. The point rather is to pursue a range of new innovative measures designed to drastically reduce smoking prevalence and which can help to achieve our endgame synergistically. So then a number of international studies have actually examined public support for endgame measures. So product-focused measures are generally amongst the most popular. So particularly the proposal to significantly reduce the nicotine content in tobacco products so as to make them less addictive. And this was supported in recent polls in New Zealand and the USA, for example. Supply-focused tactics have also garnered significant public support. For example, banning tobacco product sales near schools was very popular in England. And then numerous countries have demonstrated support for future planning aimed at eliminating tobacco product sales within a set time frame. And in some cases, this was contingent on government assistance to help currently addicted smokers to quit. Looking then to user-focused measures, public views on user-focused measures tend to be more mixed. The Tobacco 21 policy has strong public support, and a recent Irish poll last year actually found that almost 3/4 of those surveyed supported raising the legal minimum age for tobacco sales to 21 years. And this policy is also well supported in the US, Canada, Australia, England, and New Zealand. The tobacco-free generation concept has drawn mixed views, but still it is highly supported in New Zealand. And in general, tactics that place greater responsibility on the tobacco industry for the harm caused by the products they sell are popular. This includes, for example, requiring tobacco companies to pay the state for costs caused due to tobacco-related harm. So looking then at endgame implementation, there are already examples of tobacco endgame tactics at various stages of implementation across the globe. So New Zealand has established itself as a pioneer in tobacco endgame, as discussed previously this morning, with the recent release of the Smoke-Free Eritrea 2025 Action Plan. in December 2021, and this emphasised 4 endgame strategies: a reduction in the number of tobacco products sales outlets, lowering the nicotine content in cigarettes and tobacco products to make them less addictive, gradually raising the legal age of sale for tobacco products to create a tobacco-free generation, and then also combining this with increased investment in cessation supports. So other countries have introduced varying elements then of endgame policy measures to different degrees. So for example, in the US, Tobacco 21 is being implemented, and 2 jurisdictions in California, Manhattan Beach and Beverly Hills, have actually successfully phased out tobacco sales recently. Then Brookline City Council has also introduced the tobacco-free generation policy. In Australia, then, e-cigarettes are restricted to prescription-only access, and a reduction in tobacco product sales outlets is a policy objective within the most recent Australian National Preventative Health Strategy. Within Europe, Hungary adopted legislation in 2013, which reduced the number of retail outlets selling tobacco products substantially. The Netherlands have recently legislated to stop sales of tobacco products in supermarkets from 2024. Meanwhile, in Finland, there's a ban on government officials meeting with tobacco industry representatives, improving transparency regarding policymaking. So, Irish opinion of public support for tobacco endgame measures is largely uncharted to date, and we know that public support is a key lever for realising policy change. Thus, the aim of this study was to measure awareness levels of and support for a tobacco-free Ireland in order to inform future tobacco endgame policy planning in Ireland. Objectives were to gauge support for the measures that could be taken to achieve a tobacco-free Ireland, and to understand how people view the role of government and the HSE in achieving a tobacco-free Ireland. So this study involved the telephone delivery of a literature-informed survey instrument to 1,000 members of the general public aged 15 years and older, and recruitment and data collection were carried out by Ipsos MRBI in February 2022 as part of an omnibus survey. Data were then analysed by the HSE investigators, and prior to study commencement, ethical approval was granted by the Royal College of Physicians in Ireland. In terms of results, here you can see the demographic profile of participants. So of the 1,000 respondents, the majority were aged between 18 and 44 years, belonged to social class C2 or below, had reached third-level education, and 1 in 5, or approximately 19%, were tobacco product users. So then, in terms of goal awareness and support, although awareness for the Tobacco-Free Ireland goal was low at 34%, or 1 in 3 respondents, support for the goal was overwhelmingly high. 3/4 of respondents supported the Tobacco-Free Ireland goal. Similarly, over 3/4, or 77%, believed that the goal was achievable, albeit most believed that the goal was more achievable beyond 2025. So looking then at variation of goal support between tobacco product users and non-tobacco product users, although tobacco product users were more likely to be aware of the Tobacco-Free Ireland goal, they were less likely to support it compared to non-tobacco product users. But that said, over half of tobacco product users did support the Tobacco-Free Ireland goal. So looking then at variation across population subgroups, we can see here that females were 57% more likely to support the Tobacco-Free Ireland goal than males. Those of higher social class were 72% more likely to support the Tobacco-Free Ireland goal compared to those of lower social class. Interestingly, awareness or prior awareness of the Tobacco-Free Ireland goal was not significantly associated with increased support for the goal. However, as previously mentioned, non-tobacco product users were more likely. They were 2.66-fold times more likely to support the Tobacco-Free Ireland goal compared with tobacco product users, which was not unanticipated. So looking then at perceived achievability of the Tobacco-Free Ireland goal, so over 3/4 felt that the goal was achievable, but then when we break it down into when they felt it was achievable by, it's evident that the majority feel it's more achievable perhaps beyond the 2025 target. Then when we looked at the perceived role of government and the HSE in reducing tobacco-related harm and realising the Tobacco-Free Ireland goal, it was clear that over 3/4 felt the government needed to be doing more to reduce tobacco-related harm in society, and less than half believed the HSE was doing enough to tackle the harm done by smoking, and similarly less than half felt the government was doing enough to achieve the Tobacco-Free Ireland goal itself. So then, looking at the measures themselves, so the component endgame measures, starting with support for product-focused measures, extremely high support was evident for lowering the nicotine content in cigarettes and e-cigarettes to make these products less addictive. So both measures were supported by 86%, or more than 4 in 5 respondents. And very high support was also evident then for tighter regulation of tobacco products at 79%. 7 in 10 also supported a ban on added chemicals to make cigarettes more difficult to tolerate, while over 6 in 10 supported requiring individual health warnings to be printed on individual cigarette sticks. The majority then also supported banning filters on cigarettes to make the products more difficult to tolerate. So looking then at institutional structure-focused measures, again, approximately 4 in 5 were in support of requiring tobacco companies to pay the state for the health costs due to the harm caused by tobacco products. So really high support for that measure. And so, equally, there was majority support for banning representatives from meeting, representatives linked with the tobacco industry from meeting with government officials. So then in regards to support for user-focused measures, there was very high support for banning tobacco product sales near playgrounds, schools and universities. Approximately 4 in 5 respondents supported this measure, while support for raising the legal age of purchasing tobacco products to 21 years was very high at 71%, or 7 in 10. And this was very similar to findings from the Irish Heart Foundation study in late 2021. So then looking at the other user-focused measures, 6 in 10 approximately supported a ban on smoking tobacco products in public places, also supported increasing tax on tobacco products by 20% a year until less than 5% of people smoke, and also supported preventing everyone who is currently under 18 years from ever buying tobacco products for the rest of their lives. Or in other words, that's the tobacco-free generation policy, which was highlighted this morning in regards to New Zealand. And then lastly, support for requiring people to hold an official licence to buy tobacco products was more mixed at 40%. So lastly then, looking at support for supply-focused measures, there was overwhelmingly high support for phasing out sales of tobacco products. In fact, 83% of respondents supported this measure. And similar support was seen then for requiring shops that sell tobacco products to display information encouraging tobacco users to quit at 82%. So then looking at other supply-focused measures, there were approximately 6 in 10 supported restricting e-cigarette sales to over-the-counter sales through pharmacies only, for allowing tobacco product sales in a limited number of specially licensed shops only, and for reducing the number of places that can sell tobacco products by 95%. And then 1 in 2 respondents or so supported restricting tobacco product sales to restricted hours of the day, while there was more mixed support for requiring people working in shops that sell tobacco products to undergo training, enabling them to provide quitting advice to tobacco users, and then lastly for restricting e-cigarette sales to prescription-only access. So just looking a little bit closer at support for phasing out legal tobacco sales. So we know that 83% did support that measure. However, for 70% of all of those surveyed, this support for a phase-out was dependent on supports for current smokers. So either government assistance to help smokers to quit, or enabling current smokers to continue to buy tobacco products using a licence, or both. So I think that's a really key finding, that support was certainly contingent on supports for those currently addicted. So then just to summarise the main results, we looked at 22 measures in total, and there was majority support for 18 of those 22 measures. Product-focused measures were found to have the highest support levels, and the support for some of the user-focused measures, which directly target users themselves, were more mixed. In terms of the phase-out, so 83% supported a complete phase-out of tobacco sales, and 2/3 in fact believe this should occur within the next 10 years, but as discussed for the majority, this was on the condition that currently addicted smokers would be supported to quit, and that they would not be left behind. So other highly supported measures then included reducing the nicotine content in tobacco products to make them less addictive, requiring tobacco retailers to display information encouraging users to quit, tighter tobacco product regulation, banning sales near schools, universities and playgrounds, requiring tobacco companies to pay the state for health costs due to tobacco-related harm, and raising the minimum legal age of tobacco sales to 21 years, the policy known as Tobacco 21. So just to summarise, I guess, our key findings, There were high levels of public support for tobacco endgame, and product focus measures appeared to be the most popular. The majority do believe endgame is achievable, but most believe that this is perhaps more realistic beyond the current target of 2025. Public support appears to be contingent on supports for those currently addicted, and certainly considerations for currently addicted smokers need to be integral to any future tobacco endgame policy planning in Ireland. Then looking at variation across population subgroups, there was mixed support for the goal among people who use tobacco products, males and those of lower social class. And this highlights again the need for equitable endgame policy planning, which is targeted to our more vulnerable population subgroups. The public believe the government and the HSE could both do more to tackle tobacco-related harm, and that the government need to do more to achieve the Tobacco-Free Ireland goal. And then lastly, I think it was evident that public awareness of the tobacco-free goal at 1 in 3 could be improved upon. So this study has confirmed how the public are ready for bolder endgame measures to end the tobacco epidemic, and a number of key future priorities to achieve endgame have emerged. So these priorities would include the need for more progressive product-focused tobacco endgame measures, including regulating nicotine content to make tobacco products less addictive, upward adjustment of the abolition of tobacco product sales to young people, or Tobacco 21 or tobacco-free generation type measures, restriction of the tobacco retail environment in a way that's proportionate or more proportionate to the harm caused by these products, and extension of the scope of current smoke-free environment legislation. And lastly then, looking at increasing tobacco industry accountability for tobacco-related harm. So just a number of considerations emerged also just in regards to policy planning, and these included harnessing public support for Tobacco-Free Ireland, focusing on denormalizing societal acceptance of tobacco sales. We need to stop perceptions of tobacco products as a normal consumer product. They are a harmful product which, if used as intended, lead to death for 1 in 2 users. And I think it's very important that in any future policy planning, the needs of population groups most impacted by tobacco-related harm are at the core of any plans or interventions, so as not to widen or broaden existing health inequalities. So essentially, in effect, as we progress towards the end game, it's vital that nobody is left behind. So as the Taoiseach mentioned in today's opening address, it's now been 18 years since the introduction of the workplace smoking ban, a seemingly impossible step at the time, but which now represents a major success story in global tobacco control. Children born in 2004 are now reaching adulthood. However, in 2022, the tobacco industry continues to profit from a product which kills more than 1 in 2 users if used exactly as intended. Now, in 2022, the public have answered the question: is simply controlling the harm caused by tobacco still a sufficient goal, or should we now aim to end it completely? The public want to see the seemingly impossible done again. They want to bring the harm caused by tobacco to an end for everyone. This study has demonstrated an overwhelming reservoir of public support for tobacco endgame. Had the public believe endgame is achievable, had the public want a tobacco-free future for the next generation, how they are ready for new, bold, ambitious tobacco endgame measures to achieve a tobacco-free Ireland, and how a key priority of public support is ensuring people currently addicted are not left behind. Now is the time for renewed political commitment and urgent, bold action based on what we've heard from this survey. Now is the time to take the final steps towards ending tobacco-related harm for once and for all, leaving nobody behind. Now is the time to deliver a tobacco-free Ireland. So I'd like to thank everyone who gave input and reviewed our survey and gave constructive feedback during the whole process of our project. Here are my references, and thank you very much for listening.
Okay, thanks very much, Ellen. So delighted now to invite to the stage Norma Cronin, who's the chair of ASH Ireland, a council of the Irish Heart Foundation. So ASH are, as people know, leading non-governmental organisation in the area of advocacy on smoking-related harms. So delighted now to hear from Norma in relation to your thoughts on tobacco endgame.
Okay. So thank you, Paul, and thanks for that introduction. Well, hard act to follow there after Ellen, and fantastic presentation, Ellen, and a lot of work for us to be done. So what I've been asked really to talk about today, more or less, is looking back, you know, what were the key developments in tobacco control, and what were the lessons learned, the challenges we met, and the lessons learned. And the important thing was, you know, how this came about, and the importance in particular of the public support, as you've already outlined, and the research, the background to it, and all of those elements that we think are really important for successful implementation of these policies. So really, just a quick overview of, going forward. Oh, yes, okay. So the overview today, I'm just going to talk mostly about, as you can see, the smoke-free at work legislation. It's been referred to so many times today. And of course, Minister Micheál Martin referred to it because he was the key champion in that particular legislation. And, but really, more importantly, was the key elements that worked to introduce the smoking ban. So I just, another point is there that the other key areas of legislation that were effectively and introduced, and again, they had the strong political leadership and some of the other factors as well, was the ban on the point of sale in 2005, the ban on smoking in cars with children present. And that was, again, you know, our Minister for Health at the time, James Riley, Minister for Health and Children, and, you know, and other people as well. The standardised packaging, again, was successfully introduced with a number of parties, of course, and the importance of the coalition at that particular time by James Riley. But really, what today I'm focusing on, because we're going to be talking about Coalition for Tobacco 21, is the important role of coalitions in introducing strong legislation and legislative change. So, as you can see there, the political leadership, that was key for many of those initiatives. We had good research, good public support, as already you've outlined in your presentation, Ellen, the importance of that, and the importance of the coalition, of coalitions, should I say. So, smoke-free at work legislation. There are many people here, I'm well aware today, who played a very key role during this time. For some of you, you may not even remember it, because some of you are probably far too young. But, you know, you might remember it fairly vaguely. But there are a lot of people here that I can acknowledge at a later stage. But, so the smoke-free legislation, So the, going forward, the smoke-free legislation, prior to the legislation coming into effect, Ireland had a very good track record, you know, within the workplace, a voluntary code of practice in the workplace, and other legislation. But there was growing evidence about from internationally, especially from the US Surgeon General, about the hazardous effects, the dangers of secondhand smoke. So there was a very key public servant at the time who was appointed, and that was who was advising the minister. And so the Office of Tobacco Control was set up and in 2002. And the key advantage of the Office of Tobacco Control was that it was an independent statutory agency. So the key objective was to build capacity for tobacco control and current measures, and advise the minister. So Tom Power was the person I referred to, because he played a key role, and the minister always acknowledged the key role that he played in advising the government at that particular time. Of course, with other people as well, with other the public servants or people or those in the Department of Health. So the standardised. So the next, what happened was, once the Office of Tobacco Control was established, the Health and Safety Authority and the Office of Tobacco Control commissioned an independent scientific review looking at the evidence of the effects of environmental tobacco smoke in the workplace. And that was a huge study, and there was reviewed 126 academic papers. And the chair of that is in the audience today, Professor Shane Allwright. And obviously she chaired it with many other people involved in the report. But the key findings, this was really, really of critical importance. And it was really a turning point in relation to the legislation. Because what the Minister for Health said when this report was published, the key conclusions were that ETS is a category A carcinogen. And it caused lung cancer and possibly other cancers. It caused heart disease. It caused respiratory effects in children and in adults. And also high-risk category workers needed to be protected. And these included pregnant women as well, pregnant workers, because of the risk they have to the unborn child. So that was really a turning point in that report when the Minister got that report. So what was the Minister's of Health response? His response was, and this was in 2003, the Minister for Health said, you know, he got the report and he said he really announced that he would make all workplaces, including pubs and restaurants, smoke-free. Now, you can imagine when that happened, for those of you who weren't around at that particular time, the reaction was disbelief. God, this couldn't be happening in Ireland, where the pub is, you know, part of the real social centre for everything. And this was going to be impossible. But the primary purpose, Micheál Martin said, for the legislation was to protect workers and the general public from the harmful effects of ETS. And he referred to the report, to the science and to the evidence. And his quote was, "I have no moral option but to take action." So, you know, there was, as I say, disbelief and confusion among the public, among the vintners. So what happened next was, of course, the debate began. There was a huge outcry from, first of all, from firstly, the pro-health lobby group started working together. So at that time, it was the Irish Cancer Society, the Irish Heart Foundation, and Ash Ireland. So I was involved with the Irish Cancer Society at that particular time, and it was really exciting when we had got big groups together to look at the evidence and to plan the advocacy and the public support for the Minister. So the vintners, so of course what happened was the opposition, of course, was very strong, and the challenges. So the vintners condemned the government decision. They said it was unworkable, unenforceable. And then a new alliance formed, the Irish Hospitality Industry Alliance. And again, they talked about terrible job losses, economic job losses. And they said this was unworkable. And so they looked for compromise. And this was going on in the media the whole time. They wanted 50% of the pubs to be smoke-free, you know, to allow smoking continue, no smoking at the bar, better ventilation, and further research. But this, Micheál Martin, you know, he went on with the support of the pro-health lobby group then, began to gather allies. And this, again, why it's important about, you know, looking at the importance of having the support for the Minister at the particular time. So the joint forces at that time with the trade unions, which were key, really, really important, representing the bar workers, healthcare organisations and other groups. So the whole purpose was obviously to counter the IHIA economic and job loss arguments, and using national and international studies. And there were a lot of people, of course, behind this, you know, gathering the research and doing all this. For those of us who had to be in the media all the time, there was huge media. There was actually a lot of media support for the pro-health lobby group at that particular time. So any attempt, so when they said we wanted 50%, we wanted just, you know, let's keep the smoking in the pub. And the point that we made all the time was, well, first of all, the health, you know, the health was the big reason. It was about lives saved. It was about, it causes deaths, it causes cancer, it causes, and using all the factors. But any attempt to exclude bar workers, we said, would be like treating them like second-class citizens. And this is where the Bar Workers Union came in. The unions came with great support, along with the Environment and Health Service as well. So following on from that, and obviously I'm going through this very quickly, there would have been times that there was a lot more happening. with the department and with other organisations. But the public support then, the pro-health lobby grew, and then so the public support increased, and this was really important for the Office of Tobacco Control, because to have the Office of Tobacco Control there, because they continuously did the research and came out with the public support and showed that 67% of the public supported the proposed ban. Smoking had grown, support had grown among smokers, and 4 out of 10 had supported the ban. So that was really good, that the public support. Of course, there was political opposition. There was huge political opposition at that time. Some of the 2 ministers in particular came out, the Minister for Agriculture and another minister came out and publicly, said they weren't in favour of the ban, and they put pressure on Micheál Martin to reduce his, they don't go for a total ban, go for a reduced total ban, or a reduced ban. So he wasn't. There was nothing happening with Micheál Martin. He was as the opposition grew, so did the pro-health lobby group. And you can see here the importance of the large pro-health lobby group of the coalition at that particular time. And there are many of you in the audience here who are part of these organisations. And, you can see a variety. There was the unions, there was ASH, the Irish College of General Practitioners, environmental health officers, the Irish medical organisations, the National Youth Council, the Irish Sudden Infant Death Association. So this was absolutely key. So this represented 1.1 million people. So all the letters, every one of those organisations held a political briefing, and the political briefing was with all the ministers and the opposition, and everyone told their side of the argument for their particular issue. So that helped definitely with those of us who were involved in the media, and with those obviously who were to have these counter arguments. So the day came, and there was a lot happened obviously in between, because there was a big lead-in time. But in the interest of time, I'm just going to say how the ban worked initially. And so the ban worked really on the 29th of March. There was a good bit of it. There was a lead-in time and a delay, of course, and a challenge. But on the day, it was totally received so well, because people came from all over the world, to see what happened. A huge media coverage, and all the media and the newspapers at that particular time, and the print media, was saying it's working. The environment health officers then played a key role, obviously, and so 1 month later they cited that there was 97% compliance in the first month. In fact, even from the very first day, the compliance was very good. So we were Micheál Martin internationally was absolutely famous, and for the way that he continued to ensure that it was effective. So, and one year on then, there was 98% support for the smoke-free at work measures, including 80% of smokers. And of course, really, there were a lot of studies going on, bar worker studies and the health during that period as well, so during the first year. So it was really important, as I say, the pro-health lobby group, the coalition, the public support, and the Office of Tobacco Control, of course, which were a huge guide to the whole legislation. So what were the success factors? Now, there's probably too many of them there that you can see, but just for a few of them, the most important one was really the strong, consistent, proactive communication. The strong health message, and we stuck to the health message, regardless of what interview or who we were dealing with. It was all about this causes cancer, this is not just about, it's about lives saved. It's not about losses in jobs, all right, well, we had the counter argument for that, but mostly about lives saved and the importance of this. Protection of workers. Well-prepared implementation, and that was from the Office of Tobacco Control and the Health and Safety Authority, of course, and the environmental health officers, with guidance and support materials. Sustained political leadership and cross-party support, and Micheál Martin got all that during that period. Comprehensive law with few exemptions. And then the public support, of course, was important. The public support continued, and the Office of Tobacco Control continued to conduct research during that period. And so there was all that proactive, there was I'll have to move there to see a broadly based pro-health lobby group, broadly based, prepared for the counter-arguments. The trade union support, also very, very, very important. And support for smokers, and I didn't mention that earlier, because that was key at the early stage. When Micheál Martin announced about the ban prior to the smoking ban, the Department of Health with the Irish Cancer Society extended the quit line at that time. And so 7 days a week, the quit line was open, and there were hundreds of calls. And it coincided with a campaign that was used from Australia called Every Cigarette is Doing You Damage. Some of you might remember that, showing the effects on the heart and that. So it ran right through on coming up to the prior to the smoking ban and during that period. So it was a big campaign organised by the Department of Health and, of course, and the quitline then was delivered by the Irish Cancer Society with 7 days a week with 15 stop smoking counsellors. So that's why we felt it was a good success because, again, like Ellen pointed out there, what the public are looking for was the support for smokers as well. So you can't just introduce something and not have the support for smokers. So then the confidence that this was enforceable and that, you know, we had the rationale for it. So really, that's really about the smoking ban and how it worked. But, you know, again, I can't emphasize the most important of coalitions because this is where we're moving to for Tobacco 21, which our next speakers will be talking about. Just one more slide there for to show what, I don't know, I'll go back to that one. Oh, the Coalition for Standardised Packaging. Is that one gone from my slides? I wonder. Maybe it is. Is that gone, Mark, there from? Oh. No. Oh. I thought there should be a slide there with the coalition. No? Maybe not. Oh, sorry, there is, sorry. Coalition for Standardised Packaging. I just thought I'd mention that one there because, again, that was really important. And that was led out, I think, by the Irish Heart Foundation, Irish Cancer Society. But the important there was a new voice for a coalition of the children's charities, like the ISPCC, the Children's Rights Alliance, and, of course, because this was important because the coalition to show broad support again for the government to make the conversation about children and to stand up to the tobacco industry. And of course, again, having the key champion, I have to say, with James Riley at that particular time, who absolutely resisted all the arguments, the counter-arguments and the challenges, of which, as already has been referred to today, there are many of them. So looking to the future. I mean, today we're talking about here in this session, we'll be talking about Tobacco 21. But so we know the smoking rate in Ireland has stalled at, as we've heard today, at 18% in the general population. We know in the US that the studies have shown where it has been introduced, Tobacco 21, that there is a decrease in young people starting to smoke and those who smoke. The Irish Heart Foundation survey, as Ellen referred to there, also found 73% of the Irish adults supported Tobacco 21, with 70% support in the 18 to 24 age bracket. And we've heard from the Endgame survey as well, it's very similar. We have that support for Tobacco 21. So in my view, and in ours at ASH and the Cancer Society, it is time to introduce Tobacco 21. We've been the first country in the world to introduce the smoke-free at work legislation. So now let's be the first country in Europe to introduce Tobacco 21. We cannot afford to rest on our laurels. We just have action, and we've seen that today. We've heard it today from many speakers. So we'll be hearing now from the evidence and about our coalition from our next speakers. Thank you very much.
Great, fantastic, Norma. I really appreciate that. I think, as we said, this is blue sky thinking session, but I think it's really valuable for us to hear about lessons learned from trying to get the impossible done in the past. So that was great. So I'm going to introduce now Dr. Des Cox and Dr. Helen McAvoy. So Des Cox is chair of the RCPI Tobacco Policy Group and consultant paediatrician at Children's Health Ireland. And Dr. Helen McAvoy is director of policy at the Institute of Public Health in Ireland. So over to yourselves.
Thanks very much for the invitation today to speak. So I think we're going to just divide it and conquer here. Helen's going to speak a bit more about the evidence. I'm going to talk a bit more about the state of play in respect to tobacco smoking rates in young people. So I suppose we just broke it down, and I'm going to start with the first couple of points in regards to where we're at the moment. And you've heard some of this already, but so where does Tobacco 21, where does it fit with the current policy in regards to tobacco control here in Ireland? So we as chair of the College of Physicians Policy Group on Tobacco, and Helen in her remit as policy lead at IPH recently presented at the Oireachtas Committee on Health in support of the upcoming bill, which is currently under scrutiny at the moment. And we also gave additional evidence providing the Oireachtas Committee with a range of different policy measures which could be introduced to further improve tobacco control here in Ireland. So what do we know currently about smoking rates in children and young people in Ireland, and what about experimentation levels? And again, we've probably heard some of this already, but I think it's good to kind of put it into context of the Tobacco 21 situation. So if you think about children who are trying their first cigarette or their first vape, most children at some stage do experiment with tobacco smoking. And what happens between the ages of 17, 18 and 21 is quite significant. There's a number of surveys which I'm going to refer to, one of them being the Growing Up in Ireland survey, which looked at smoking rates around 20-year-olds. And basically 3/4 of all of them had experimented at least once, and the average age was 16. And then between the ages of 17 and 18, the rates of smoking almost doubled. So in this age category alone, the rates went from 12% to 23% in occasional smokers, and from 8 to 15% in daily smokers. So again, although in this cohort, young children were starting small but younger, but there was an exponential rise in their smoking rates when they got to that slightly older age group. If you think about if you examine other surveys which were done in 2019, a survey of 1,000 postgraduate and undergraduate students in Ireland found that the average age of that they started smoking at it was 49% at the age of 18 or older, and then it was 43% between the ages of 15 and 17. So again, the largest percentage being in that older age category. And then also, which is also a very important, speaking as a pediatrician and a respiratory pediatrician, the age that the children start smoking is really crucial in regards to the harm that they do to themselves. So studies have shown that from the US and from here as well, that if the younger you start, so if they've started before the age of 14 smoking, that the average 34 cigarettes per week, whereas in those who start smoking a bit later at the age of 15, they smoke significantly fewer. And that was borne out in the Growing Up in Ireland as well. And there was a threefold risk of smoking, or of being a daily smoker, if they started before the age of 13. Again, just kind of shows you that this is something that it's really this whole age group and category of tobacco smoking. It really is crucial that we try and tackle this problem, because young people can do a lot of harm to themselves from quite an early age. So just in regards to access, because access to tobacco products is also, you also saw that from the survey, that there's a lot of support for restricting access to tobacco products. And again, looking at some surveys from Ireland, most 15 to 16-year-olds reported that they think it would be fairly easy or easy enough, or very, very, very easy to get their hands on tobacco products. And then if you look at it, if you break it down into just second to fifth class students, a third of them would find it very easy or easy to purchase cigarettes. And then where are the sources? So not only are they going to the shops themselves, but there was a report in Northern Ireland which demonstrated that they were accessing cigarettes from their friends as well. 42% of them were doing that. And then just under a third of them were accessing it by buying it through a shop themselves. I know that Paul had presented some data on test purchases, but the data from the HSE in 2018, which is probably a bit updated, but about 1 in 14 test purchases failed, that no age identification was sought. So again, we're like, it's an issue. There's a lot of work still improvements we could do on here, but it does show you that kids can still access tobacco products. So what are the key trends in terms of tobacco smoking in children? So again, I'm going to refer to two very important surveys and some data that was referred to earlier. But in the health behaviours in school children survey, the last one that showed that there was a significant decrease in smoking overall from 8 to 5% in the most recent one. And that trend is obviously, as we've seen, the great work that has been done by TFI and the HSE in getting those tobacco rates down. But, and this was referred to earlier on, the SPAD survey, which found that 16-year-olds, there was a slight uptick in males, in teenage boys in that age group. And this is what's worrying, tobacco control advocates across Ireland at the moment, is that maybe progress has stalled. And importantly, this is the first noted increase in tobacco use amongst children in the 25 years of available data. And just before I hand you over to Helen, just in regards to e-cigarettes, again, the SPAD data showed that the number of children who ever use e-cigarettes increased from 23% to 37% from the years of 2015 to 2019, and then the current use went from 10% to 18%, so nearly doubled there. So again, this is all pointing in one direction, that there is experimentation, and they are currently using it, and this would be borne out by the excellent panel that we had here earlier on. And then finally, there is good evidence from the health behaviours in school children survey reporting that e-cigarettes is now twice as common as e-cigarettes use. And then also what's even more worrying, again from a public health perspective, is that most of these are using both e-cigarettes and cigarettes. And again, that was brought up in the panel. And just on a final note, the HRB report does show that there is evidence that the use of e-cigarettes is a gateway to tobacco, and in that that adolescents who use e-cigarettes are 3 to 5 times more likely to go on to tobacco smoking. So again, that's an important fact. So I'll hand you over to Helen now. Thanks.
Thanks very much, Des. I'm going to give you a very quick run through about Tobacco 21 laws, how we think they might work, some of the evidence behind them, and some thoughts about what they might look like in Ireland. So when we think about Tobacco 21, it's kind of important to think about all the different types of science we need to consult to think about how they work. One example of this is neuroscience. We've learned, even just in the past 5 years, much more about how nicotine interacts with the brains of children and adolescents, because those brains are still under construction. Nicotine activates the brain's dopamine reward pathway, which plays a role in desire, pleasure, and impulse control, which is a lot of what goes on in your teenage years anyway. We can put a bit of puberty on top of that, and this is really quite a mix. The parts of the brain responsible for decision-making, reward, and emotional regulation continue to develop until at least the age of 25. And even brief exposures to nicotine can produce lasting changes in the adolescent brain. And some of the way that this has been articulated is that it actually can introduce coding errors in the wiring of the brain that wire the brain to nicotine addiction. So how can Tobacco 21 work? Two main routes to think of. The first one is reducing the accessibility of tobacco products to young people, including both children under 18 and those in the 18 to 21-year-old age group. So it deters young people from attempting a purchase and encourages retailers to set their age verification at 21 by reducing the opportunity for older teens to buy cigarettes for younger teens. So those two supply pathways, the shops and their friends. The other piece is around denormalizing tobacco and nicotine products, reinforcing on a societal level, as well as to young people, the very highly addictive and health-harming qualities of the product. The higher age of sale delineates the products in the retail environment and signals that this product is harmful. So where have these laws been introduced? Well, they were introduced on a phased basis across the USA, including Hawaii, but also in Kuwait, Sri Lanka, and Singapore. And while no European member state has yet introduced the measure, there's been a lot of discussion about it in the European tobacco conferences and the European and in the literature. There is no legal obstacle to individual member states setting domestic policy on legal age of sale. So what is the evidence? Well, most of the evidence comes from the USA. The first set of evidence came from Needham in Massachusetts in 2005, and then there was subsequent evaluations in New York and also in California. The initial studies that were published looked at the outcome of tobacco initiation, and the later studies started to say something else is going on here, because we're also going to look at current smoking. They also looked, as well as those end outcomes around people taking up smoking and smoking levels, they started to look at things like retailer compliance. They started to look at which brands were now being sold in lower quantities, largely the brands purchased by younger people, and so on and so on. Lots of very complicated study designs. For example, Friedman's seminal study looked at 18 to 20-year-olds and compared them with 21 and 20 to 22-year-olds in states that did and didn't have tobacco 21 laws. So over time, the sophistication of the research to answer the questions has become better, and also there's been less reliance on single studies. So the outcomes from these studies have been put into modelling studies, most notably the Academy of Science study. This suggested that 15 to 17-year-olds would benefit most from increasing the legal age of tobacco products to 21. So the group that we expect to most benefit is the 15 to 17-year-olds. And Des had talked earlier about what's happening with that 17-year-old group in terms of the transition into more regular smoking. So two models, the CISNET and the SimSmoke model, have projected the sort of longer-term impacts on adult smoking prevalence. As you can see, the different lines here represent introducing the minimum legal age at 19, 21, and 25. 2,100 feels like a million years away, but these will be cohort effects from introducing this now. But what you will see in the shorter term, if these models are correct, is quite substantial reductions in that early adult group. So, and I've referenced some of the findings there from Friedman's sophisticated study. The All-Party Parliamentary Group on Smoking and Health in the UK has published a report, and they included modelling estimates for England. They are suggesting that there will be a very substantial reduction in the total numbers of 18 to 20-year-old smokers, reducing smoking in that group to 2% among 18 to 20-year-olds by 2030. And without this measure, the smoking prevalence in that group would be around 9%. So I've mentioned here just some of the findings here from the USA. There is a study that looked at what happened in New York that had mixed results. However, there was really a very strong battle for Michael Bloomberg to progress the introduction of the law in New York. He had just 60 days to, he decided to implement the law in 60 days, which is not a lot of time to implement a law, in over 300,000 retail units, 3 for every McDonald's that there is in New York City, along with a whole range of other measures. The issues, I think, in relation to the New York study were largely the challenge that they faced in implementation. They had also already transitioned to 19, so they're comparing their pre- and post-study findings meant that they maybe didn't see the results that were seen in California and Massachusetts. So what can we learn from the experience of largely the states in implementing Tobacco 21? Well, the evidence seems to be that youth smoking rates declined. We know that they're declining anyway, but they declined above what was expected, and we could see differences when there was comparisons between states that had implemented and states that didn't. some interesting stuff happening around brand identities, where the sales of certain brands started to fall, largely those brands that were most heavily marketed to children and young people. Public support was high, retailer compliance was achieved. We have some early evidence that there was some reductions in illicit tobacco sales to youth, which was quite interesting, but may not be replicated over time. And some early evidence around some communities which may benefit more, particularly in the States around the Latino community, but it's a bit unclear how this might translate to different social contexts. And the challenges are the old chestnuts here in terms of opposition from the tobacco industry, which is probably a good test that the thing might work. In many forms, including direct and indirect lobbying, misinformation, failure to disclose conflict of interest, use of SAPROs, which are sort of front organisations, which sometimes sound really nice and look really nice, but actually are largely driven by the interests of industry, discrediting evidence of effectiveness or producing their own evidence from different sources. I think the challenges, again, were around the time, energy and resource that's needed to create strong alliances, but also nimble alliances that are able to work in complex systems. Context-relevant evidence and modelling is important. We have estimates for what this might give in return in the UK. I think it would be really useful to have some modelling for Ireland. Retailers need both support and enforcement to comply and play their part in this. It's not terribly helpful sometimes to introduce laws in a very rushed way because change management is needed for all sectors, and also online sales, which maybe weren't so much of an issue in the ones in the States, maybe something we need to keep an eye on. So I'd like to, first of all, thank Lauren Rodriguez and the rest of my team for all the work that they've done supporting some of the evidence review we've done on Tobacco 21. We have a Mythbuster on Tobacco 21 running on Twitter on our Institute of Public Health Twitter account today. If you feel like you've got something challenging to say about Tobacco 21, I hope I have some of those questions answered in that. And I think that's it from me.
So I'm conscious, and it's a testament to the quality of the speakers, just that we're a little bit caught for time. So we're just going to invite Mark then to take the final minute to introduce a new announcement from the Ash Ireland and the Irish Heart Foundation.
Thanks, Paul, and thanks, everyone. I know this won't be a long presentation at all. It's actually only one slide. So I'm delighted to say, on the back of all the evidence put forward there, the strong public support from both the Ellen's survey and the Irish Heart Foundation survey last year, and the effectiveness put out suggested by Des and Helen, and Norma's presentation on the importance of alliances. We're here to announce the Tobacco 21 Alliance to increase the legal age of sale of tobacco and e-cigarettes from 18 to 21. All these great organisations here. I'm delighted to say Suzanne and Joan are here from the Irish Thoracic Society, and COPD Ireland support Ireland also. We have a number of Corlin and Oaks from around the country. These are youth groups from around the country in support for Tobacco 21. So it's only the start of a long campaign. We hope to have the RCPI with us on board soon, and we'll be open to any kind of organisations and health organisations supporting us. So it was just really just to launch the presentation, and I know Paul is telling me to step off now. So thanks very much. Thank you.
So we're just, in terms of time management, I'm conscious that we have run over. So those of you who want to can leave to go to the other parallel session that you've booked into. And we're then back here in about 20 minutes.